You are listening to the Big Blue Podcast. I'm Greg Stone, Metro Campus Provost, and I'm here as always with President Leigh Goodson. Dr. Goodson, good afternoon.
How are you?
I am doing really well, and we are here in the Thomas McKeon Center for Creativity at the Metro Campus with our guests today, Midge, Elliot, Dean of Health Sciences, and Dr. Angela Sivadon, Associate Dean of Nursing. Thank you both for coming over. I appreciate it.
Thank you. Good on a cold day.
On a very cold day. Midge, I want to start with you. Some of our health science programs have been notified that they're going to receive some new funding, and you and I were actually just talking about this earlier today in another meeting, one of many meetings that I get to have with the two of you throughout most given weeks. Give us an update about where we are in terms of some of our recent grant funding sources and how that translates into wins for our students and our faculty in health sciences.
Yes. Well, I'm very excited to share first the most recent funding from the Perkins Federal Grant Awards. And this year, the Allied Health Programs received $160,000 in Perkins grant funding. This was one of the first years that nursing had not applied. But what we received so far this year is a brand new Pano x-ray machine for a dental hygiene clinic that was over $51,000 and couldn't have been purchased elsewise. Also, the respiratory care program received a mature Annie mannequin and a ventilator. So these things are critical to the laboratory simulations and the student learning. So over the last 7 years, we've actually received almost $800,000 in Perkins funding just for health sciences. So you can see what a benefit that's been. And also that's covered the full-time equivalent salary and benefits for Adrienne Moorcraft, our marketing specialist for health sciences. So that's been a great thing. But we have benefited tremendously from numerous local, private, and federal funding sources. And just to name a few, over the last 7 years from Founders and Associates, we've received over $570,000 in equipment funds. And if the most recent grant that I put in for respiratory care gets funded, we will have almost $660,000 total in that amount of money.
Fantastic.
It really has been great. Of course, you all are familiar with the Health Professions Opportunities Grant through the CAP program. That was a tremendous thing. Linda Smith helped me put this together. Over the 5 years that we were funded for that, there were 16 FTEs covered and $750,000 in tuition and fees. So that was
FTEs being
full-time equivalent nursing
equivalent.
and HIT faculty salaries, which represents about $1.6 million right there alone.
Well, and even the and I don't remember her name because I know she has a name, but the
Most people have a name.
The cadaver over in the Janice over in the Physical Therapy Association.
Right.
That was the result of Perkins grant, right?
It was,
which is a great learning opportunity for students. I have yet to be over to see her because I've heard, but yeah, if you're a PTA student, to have a human body there that you can really look at how that body functions, and
it's quite interesting.
Together,
I've had an opportunity to meet Janice.
yes.
And
I've heard she's very quiet, but
she's quiet, but I don't want to say accurate, but she's it's semi-real.
Yeah.
It feels semi-real, and that's what the simulation opportunities are all
Right.
about, right?
Yes, and that's occupational therapy assistant students are also
Yes,
using it.
that's right.
And so it really helps them to see the insertions of the muscles and the origin. And, where out of a textbook, it's just not the same at all. So we're going to share the warranty on her beginning this year between those two programs.
Lots of great stuff.
Yeah.
Lots of great stuff.
Well, Dr. Sivadon, you are in a new position.
I am.
Sort of. Like how long have you been there now? Summer?
August 1st.
August 1st. That's not very long. And you just had your first nursing pinning as the Associate Dean for Nursing. Congratulations.
Thank you very much.
So you came to that role, Associate Dean for Nursing, from being the program director of the Cardiovascular Technology Program. So those are pretty different, in terms of responsibilities. And one is out in Owasso, and of course one's mostly based here on Metro campus, although you have a lot of activity on the Southeast campus also. Tell us how that transition's been and what you like most about it, and maybe what you miss about CBT, and just how has this transition been for you, Dr. Sivadon?
Well, it certainly has been a learning adventure, without a doubt. And I've kind of gone full circle because when I started at TCC, I was a nursing faculty then. I was teaching in the nursing program. And then I had an opportunity to do the CBT program, and that gave me a different view as far as the logistics. What does it take for a student to get enrolled, to be accepted to a program, and all the things that go along with getting the student started. And then some of my work that I've done college-wide, it helped me to have like a holistic view of the student experience. From the classroom, getting through all the hoops that you have to jump through, to get into college and get started like that. So that's been fun to see it from that standpoint. It's been nice because I've had an opportunity to work with faculty that I've worked with before, even though it's in a different capacity. That's been a little easier than I thought it would be. I was a little concerned about that, what that would be like coming back into the fold as an administrator instead of as one of their colleagues. And it's been really nice because we talk the same language, we have some of the same goals. They want students to be successful, and I'm really looking forward to helping that happen. Faculty are thinking outside the box. How can in today's time we've got to figure out how to do more with less, and how to support our students with all of the barriers they have. And faculty really have some great ideas we've been talking about and looking at what can we do going forward to help students be successful.
Well, I do want to ask you both about interdisciplinary programs and learning opportunities, not just even among allied health programs, but with nursing as well. I mean, you've both had a lot of interest in that, and Angela, your experience in both nursing and in an allied health program, speak to that. Why is interdisciplinarity important to your leadership in health sciences, and how does it benefit student learning?
I'll go ahead and start with that. The Institute of Medicine, the Institute for Healthcare Improvement, and the Robert Wood Johnson Foundation all strongly believe that a key to safe and high-quality care is only met through more strong intercollaborative practice. And they really encourage us to start this early in the educational process. We know that you reduce deaths and errors if we're communicating better together. This passion of mine for interdisciplinary collaboration came before I came here, when I was in charge of funding and directing an interdisciplinary clinic at OSU, and that was with medical residents, pharmacy students, nursing staff, case managers, and psychotherapists, and the synergy of that care was incredible and had a huge impact on those patients under a chronic illness model. But when I came here, I thought, what a great opportunity. We have all of these programs. And so one of the first grants I wrote was to doctors to obtain the iStand mannequin. That's a high-fidelity mannequin. And we invited and carried this out with OSU medical residents and our nursing and respiratory care students, a tremendous simulation. And what was pretty cool about that was that the residents really were impressed with the level of knowledge of our students. They didn't understand it before, how knowledgeable they could be. And this makes a tremendous difference for our students. Nursing is the most advanced with their use of simulation, but it's a safe environment. They could make errors and make mistakes and learn from it before they practice on real people. So we're really trying to encourage more of the allied health practitioners and faculty and students to do this. Scheduling is a barrier, but we've got a new simulation coordinator who is very committed to making this happen, so I'm thrilled.
Angela, what are some of the kinds of things, just quickly, that students are able to do in simulation that that we have opportunities for?
Well, one of the simulations that we had this past semester with respiratory care students and nursing students, we put them together in a simulation. So you have a patient that has breathing issues, is on a ventilator, and so part of it's what respiratory care does and part of it's what nursing does, and so we were able to have a simulation together with those students. And so they learn how to work with each other. We have learning outcomes from nursing, learning outcomes from respiratory, so how do those match up for the best benefit of the patient, And so we put it in a situation where a patient is under respiratory distress and having a hard time breathing, and what do we do? So you get the nursing side of it, and you get the respiratory care, and they learn how to work with each other in that environment where no one's going to die. Then it really helps them when they get into that environment where there's a little more high stakes, that they know a little bit what to expect from each other, and it also helps that communication piece, which is a really strong skill that we want the people to have out in the healthcare setting, to be able to talk with each other.
Gives them some confidence.
It does. It does. You know, and sometimes the failure is just as good a teacher as success is. You know, so when we can do it in that environment where no one gets hurt and students can take away from those mistakes, you know, what not to do next time.
Huge.
It's exciting. I'm Leigh Goodson, here with my co-host, Dr. Greg Stone, and you're listening to the Big Blue Podcast. Our guests today are Midge Elliot, the Dean of Health Sciences, and Angela Sivadon, the Associate Dean of Nursing. We've been talking about TCC's Health Sciences program. So we're in the middle of the Pathways Project, and really we've become a Pathways school, right? And Health Sciences has been doing Pathways a long time. You all have been putting your students in cohorts, and this is what you're going to take this semester, and there really aren't that many choices. And you've been, everybody says, well, nursing does it right, and we're like, well, nursing's been doing it right since the beginning, and so have a lot of other cohort-type programs in health sciences. But one thing that's included in Pathways that doesn't get talked about quite yet, because we haven't arrived at this point quite yet, but we're working our way towards it, is what are the job possibilities and what are you going to get paid if you major in nursing, engineering, manufacturing, liberal arts, music, you know, what kind of job can you go out there and get? How, what's the market out there for health science graduates? And tell us, how do we respond to the community? Because I know probably a follow-up question is going to be, how do you gauge your class size so that it can meet the needs of the community? And there's some challenges around that. So you want to kind of talk about that a little bit?
Sure, I'll start with that because, matter of fact, I went to a meeting this morning with deans and directors. So it was a meeting with the area associate degree nursing program directors, and then our contacts with our community partners at the hospitals. So the major hospitals were there. Someone from St. John, St. Francis, Hillcrest.
So area associate deans of all the universities and colleges in the area that teach nursing, or just TCC?
No, in the area that.
So like Rogers State,
Yep.
TU, OU,
ORU, Wesleyan was there, and
Wow.
Tulsa Tech is there. So we meet
Like a
we meet once a
consortium,
month.
yeah.
Yes, so that we have that. So we have one that's just Tulsa area, and then we also have one that's all of Oklahoma.
Okay.
And so you go and you hear, you know, what's going on with the other schools, but also what the hospitals. And then the number one question is, how many are graduating and how many are you admitting? You know, so as far as nursing goes, the market's going to be there for nursing from here to the end of time, I think, because there's just always going to be jobs opening, a shortage of nurses, even in the clinical clinic setting as well as the hospital setting, and so pretty much once you pass your NCLEX and get your RN license, you could get a job in Oklahoma. And one of the things, I think that was pretty much it for me as far as the nursing goes, is that they're asking all the time, you know.
Yeah. When can you increase? I get,
Right.
I mean, when I'm in meetings with hospitals, I think I'll just interject here for a moment, but, you know, we get the hospitals saying, why can't you just double your class size
Right.
for nursing or for whatever? But there's a limitation, right, Midge?
Yes, well, clinical rotations are
Right.
one
That
limitation.
is the biggest
And
limitation.
qualified faculty, too.
Right.
But nursing's done a tremendous job in increasing retention. And to have 144 graduates at one time this past December was fabulous.
That's incredible. Congratulations.
Yes,
you.
it
Thank
really
you.
has been great. I thoroughly enjoy attending the advisory committee meetings in the community. They always are so complimentary of all of our graduates. They want all of them to come to work for them. And if our grads want a job, they've got one. They can go to work. And we do pay attention to what the community needs. We responded with development of the diagnostic medical sonography program and the cardiovascular technology program out of a community need. So we keep our hand on that pulse. And Angela's already trying to look at how the nursing program could be expanded. So it's very exciting.
Yeah.
I have no doubt.
Just really quickly for both of you, what types of students are your programs looking for, right? I mean, obviously there are some GPA requirements, but there are also some other kinds of characteristics that programs look at when students are applying to them. What types of students really are allied health and nursing programs looking for?
Well, that's a very good question. It's actually changing at this point. Historically, as you mentioned, we have really heavily emphasized the cognitive, and we've done GPA and ACT and science scores and reading scores. And what the literature is telling us is it's really the non-cognitive that evidences persistence and success. So I've pulled together a task force, and nursing and allied health are all represented on this. And we're looking at all the various non-cognitive measures that could be used, the best practices in the area. And what Angela did reach out to the hospitals and say, okay, what non-cognitive admission attributes do you want to see in our graduates?
Yeah, and some of the feedback we got was good communication with the public, enthusiasm for continued learning. You know, this is some of the stuff they want to see when they come. Dependable, takes constructive criticism well. You know, so the same thing that they're looking for in employees is what we're looking for in students, to be able to provide that employee to them at the end. Good work ethic. You know, things like that. Some of that stuff that may seem to be challenging to teach, you know, it's not necessarily something that comes out of a textbook. Some of it's more behavioral type things.
Well, Steve Milam came and presented it on essential functions, and it seems to me the best thing we could do, and he's worked with medical students up north and done, he actually turned their interviewing upside down. They begin with the non-cognitive mini-medical, or multiple mini interviews based on essential functions like integrity, empathy, critical thinking, judgment, and then they do the cognitive. And
they do that screening first. They do the
Yes.
non-cog screening first and then go to the cognitive. Interesting.
Yes, so that's what our group is considering, and how we could increase the interviewing of all of our applicants. The biggest challenge, of course, would be in nursing, because there's so many. You know, the smaller cohorts are not a problem really. Yeah. But we'll do our best.
We're even looking at maybe students submitting self videos. Interview, you know, send them an interview question, and so when they turn in their application, you know, then maybe they might, you know, do something like that just to kind of help,
Well,
you know,
for
add
today's
to some of the
student,
things.
that's something
right.
that they can probably do. I could never have done that, but that was 30 years ago, right? So
We're moving on.
I know we're moving
Exactly.
on from 30 years
Exactly.
ago. Well, we have one final question for each of you. It won't be the same answer probably, so you can't really answer it together. But if you could go back in time and give your 18-year-old self a piece of advice, what would it be?
You want to start?
Sure. I think first would be ask questions. Don't sit and wonder, you know, whether you're going to find out. Be persistent about things. And then probably the biggest thing is that you're just as smart as everybody else in the class is. You know, that you're just as good as the other students. So
That's really important.
It is.
I mean, when you're 18 or 19 or 20, you're sitting there and you're like,
yeah.
it seems like it's one way or the other.
Right,
You know,
right.
You either think you are the smartest person in the room, or you think you can't be
That's exactly
possibly
right.
as smart as these other people. So,
Exactly right.
Yeah, that's
So
good.
that'd be the main thing for me. I
Good
think.
advice.
Yes,
Midge?
that is good. You know, I gave this a lot of thought, and I thought my mother did give me some very good advice that I'll share, and that was, don't ever rely on another person for your livelihood. And, you know, they were both well educated. My mother had a master's degree when many did not at that time. And so I always knew I'd go to college, and then I put myself through 3 more degrees because I just so enjoyed school. But it's been a good thing because I can support myself. Yeah. And, you know, that's advice for today's young women and men that I really think is good now. Additional things are, don't take things personally, because most of what people are responding to have absolutely nothing to do with you.
Right.
Especially in this day of social
That's right.
media and
It's not about you.
instant
Exactly.
feedback.
Yeah.
Yeah, that's great advice. Thank you both. And it's been great to visit. You've been listening to the Big Blue Podcast. We want to thank our guests, Midge, Elliot, and Angela Sivadon, for joining us today. And we want to thank you for listening. Remember, you can catch the Big Blue Podcast each week on the week at TCC and on the Creativity channel at YouTube. Thanks, Greg.
Thank you.
Thanks, Midge. Thanks, Angela.
Thank you.
We'll see you next
Thank
time.
you, Leigh.
Thank you.